Welcome to the Technical Assistance Network for Children's Behavioral Health, Cultural and Linguistic Competence Peer Learning Exchange. The Peer Learning Exchange is a webinar or monthly calls of topics focusing on culture, health equity, and disparities in children's behavioral health. Topics are generated by you, individuals working in or being served by behavioral health organizations and partnering with system of care states and communities. The TA Network, as it is known, is the National Training and Technical Assistance Center for Children's Behavioral Health for the Substance Abuse and Mental Health Services Administration. Today's topic is an invisible population, trauma, and children of incarcerated parents. I am Selena Webster-Bass, CEO of Voices Institute and a core partner with the Technical Assistance Network for Children's Behavioral Health and Cultural and Linguistic Competence team. Today's discussion will be led by a diverse group of presenters representing various perspectives and multiple systems: the behavioral health system, the primary care system, law enforcement, advocacy organizations, and even the media arts. I am honored to introduce you to our presenters. Isadora Kosofsky is a Los Angeles-based documentary photographer and filmmaker. Her focus is to document American social issues from a humanistic stance, focusing on individuals, relationships, and families in the context of mass incarceration. She received an Inge Morath Award, the Magenta Award, among others. She has contributed to Time Magazine, Le Monde Magazine, the London Sunday Times, Slate, the New Yorker, and many others. Our second speaker is Allison Holohan, who is the Senior Policy Manager for the New York Initiative for Children of Incarcerated Parents, a special project of the Osborne Center for Justice Policy and Practice at the Osborne Association. The New York Initiative for Children of Incarcerated Parents works in partnership with government agencies, diverse organizations, and the faith-based community to safeguard the needs and uphold the rights of children whose parents are involved in criminal justice systems. Allison previously oversaw Osborne's video visiting program where children visit with their incarcerated parents through video in a supportive and child-friendly environment. Allison also has 10 years of experience working as a foster care caseworker and supervisor. Dr. Makai Owen is an assistant professor in pediatrics in the Division of Community and Societal Pediatrics at the University of Florida College of Medicine, Jacksonville. Dr. Owen completed a fellowship in community and societal pediatrics at the University of Florida College of Medicine and earned his medical degree from the University of California, San Francisco, and a master's degree in public health at the University of California, Berkeley. Dr. Owen's clinical work focuses on the development of systems of care for marginalized children in Jacksonville, Florida. Our next two speakers are with the Children of Inmates, Inc. Shelley Solomon is president of Children of Inmates, Inc., a nonprofit organization focused on providing services for children and families with incarcerated parents. Currently, Ms. Solomon leads the Service Network for Children of Inmates, working in collaboration with the Florida Department of Corrections, the Department of Children and Families, and the Children's Trust of Miami-Dade County, Florida. Ms. Solomon is a PhD fellow in governance, and she has a master's from the University of Rochester in public policy analysis and a BA in economics from the University of Oklahoma. Jada Hunter obtained her Master's of Social Work from the University of Chicago and has worked with the social service community for 18 years. She has 13 years of nonprofit administrative experience, capacity building, professional training, and working with children and families with mental health and mental illnesses. She is currently the Deputy Director for Client Services and Infant Mental Health Specialist overseeing the Babies and Brains Initiative and serves on the statewide expansion team of Children of Inmates. Our last two speakers are with the Albany Police Department in Albany, New York. Cassandra Goddard is the youth aide and facilitates case management for youth who are involved in multiple systems. She has worked on the development of the Safeguarding Children of Arrested Parents policy for the Albany Police Department and has also worked with the Albany Youth Court. Cassandra is the co-chair of the Capital Regional Youth Justice Team's Children of Incarcerated Parents Group and is a steering committee for the New York Initiative for Children of Incarcerated Parents. Chief Brendan Cox joined the Albany Police Department in 1994. He was promoted to sergeant in 1998 and eventually served as a detective sergeant in the Children and Family Services Unit. In 2004, he was promoted to lieutenant, and after serving a short time in charge of the Special Operations Unit, returned to the Children and Family Services Unit as a detective lieutenant. In 2013, he was promoted to deputy chief, and in March of 2015 was promoted to acting chief. He was confirmed as the chief in July of 2015. Chief Cox retired in January of 2017 to work with Lead International, establishing law enforcement assisted diversion programs across the country. We are really excited to have such a wonderful panel of participants and presenters today. At the end of the presentation, we have 10 minutes scheduled for questions, so we encourage you to use the chat box for your questions so that our presenters may answer your questions. And also at the end of the webinar, we will remain open for about 5 minutes so that you may download the PowerPoint presentation. And so we really appreciate you joining us today on our presentation, An Invisible Population, Trauma in Children of Incarcerated Parents. Our learning goals for today are to describe the epidemiology and the social, emotional, and economic impact of parental incarceration, to discuss behavioral health and primary care integration specific to children of incarcerated parents, and finally to describe interventions, policies, structures, and processes to reduce trauma in children of incarcerated parents. The United States accounts for only 5% of the world's population, but is responsible for nearly 22% of the world's prison population. The U.S. incarceration rate climbed steadily throughout a 30-year period beginning in the mid-1970s, coinciding with the most aggressive era of the United States war on drugs. Incarceration did not reach a peak until 2010, with over 2 million people behind bars. These decades of growth and eventual record levels became the cornerstone of the term mass incarceration in America. Today, the American criminal justice system holds more than an estimated 2.3 million people in state prisons, federal prisons, juvenile correctional facilities, local jails, Indian country jails, military prisons, immigration detention facilities, civil commitment centers, and prisons in the United States territories. This creates an unstable environment for kids that can have lasting effects on their development and well-being. Children feel the impact of parental incarceration by the loss of income, loss of stable home, and several other intergenerational consequences. Nationally, according to the United States Census, blacks are incarcerated 5 times more than whites are, and Hispanics are nearly twice as likely to be incarcerated as whites. This slide shows racial and ethnic disparities in prisons and jails. The circular dots represent the U.S. population by race and ethnicity, and the squares represent the percentage of individuals in jail and prison by race ethnicity according to the U.S. Census data 2010. Whites make up about 64% of the United States population and 39% of the jail prison population. Blacks make up about 13% of the U.S. population and comprise 40% of the jail prison population, a disproportionality. Latinos are about 16% of the U.S. population and make up 19% of the jail prison population, another disproportionality. Native Americans make up 0.9% of the U.S. population and approximately 1% of the jail/prison population, another disproportionality. The racially disparate application of punishment to people of color can be traced back to historical injustices and structural inequities. In the modern era, drug laws have become the instrument of racial subordination and the rationale for harsh punishment. We know that these populations are not inherently more deviant. We do know that socioeconomic and structural inequities such as implicit bias, policies such as stop and frisk, racial differences in sentencing, differences in legal representation impact incarceration rates for people of color and people from disadvantaged and marginalized populations. Currently, there are national reform efforts for diversion programs, drug treatment programs, community policing, and even cultural competency and health equity training for systems partners and ban-the-box initiatives to address these inequities. As a result of these disproportionalities, children of color are more likely to contend with having a parent in prison. According to the 2011-2012 National Survey of Children's Health, more than 5 million children have had a parent incarcerated at some point in their lives, including over 500,000 children in California, over 450,000 children in Texas, and over 300,000 children in Florida. Children with a parent who is incarcerated are typically younger, under the age of 18, living in low-income families of color, and usually with a young single mother who has limited education. Among the United States, the percentage of children with an incarcerated parent varies dramatically, from only 3% in New Jersey to 13% in Kentucky. Kentucky has the highest rate of children with incarcerated parents. Parental incarceration has a wide range of consequences, and a few of those consequences are listed here. Parental incarceration is identified as an adverse childhood experience and has also been shown to predict depression and depressive symptoms, anxiety-related disorders, and trauma among children and adolescents. Studies suggest that parental incarceration places children at greater risk for a range of mental health-related issues. They're more likely to have low self-esteem, to report feelings of loneliness and isolation. So the importance of child-parent bonding is critical for children experiencing parental incarceration. And today we will hear about, some of our speakers talk about the potential aspects of youth with incarcerated parents. Parental incarceration also results in economic instability and deprivation for those left behind. For many families, parental incarceration depletes families' existing resources, oftentimes the resources that were lacking prior to the episode of incarceration. Children with incarcerated mothers are more likely than those with incarcerated fathers to end up living with grandparents, family, friends, or in foster care, and as a result tend to experience greater disruption and instability. Parental incarceration can become exponential in often low-income communities, especially if parents are living in community or families are living in community where a significant number of residents, particularly men, are in or returning from jail or prison. Fathers who have been incarcerated are significantly less likely to be employed and to report consistent work, and they earn significantly less compared to those that have not been incarcerated. Research also suggests that parental incarceration increases the likelihood of school disciplinary issues such as suspensions, expulsions, and also other educational challenges. For example, teacher stigmatization within school environments. Teachers may even label students as less competent because of parental incarceration. So I've just provided an overview of the impact of trauma in children of incarcerated parents. Our presenters will go into more details, but our next speaker is amazing. I had the opportunity of meeting her at a bonding visit at a local facility in Lowell, the Lowell facility in Ocala, Florida, and she is amazing in terms of humanizing the experiences of children of incarcerated parents and understanding some of the challenges that they face. So at this point, I'll turn it over to Isadora Kosofsky to share her documentary of photos of children of incarcerated parents. Thank you, Isadora.
Selena, it appears Isadora lost her phone connection.
Okay. All right, so we'll just advance. Is she here?
Hi, Isadora.
Here I am. I'm so sorry. I apologize. Technical issue. Hi, everyone. Thank you so much for having me. I will be speaking very briefly about a visual documentary about bonding visits that take place between children and their parents in the state of Florida through the Children of Inmates program, which you'll be hearing more about a little later from Jada and Shelley. I just want to talk about collaboration between photojournalists and not-for-profit organizations and the importance of visualizing trauma and also unification between parents. There's very little imagery at this time in media and public outlets that focuses on incarcerated parents and their children. I began photographing in the prison system 5 years ago, actually primarily looking at families in the juvenile justice system. And over the course of working with one family for 4 years, I noticed how little physical contact the older brother that I was documenting was able to have with his child because the facility that he was housed in only had video visitation. That eventually led me to working with Children of Inmates in order to look at how intimacy manifests between parent and child in these visits and the importance of having intimate contact. So the purpose of this particular series is, of course, for general public to be able to interface with these families in a humanistic manner. But most importantly, because of the amount of alienating imagery that we see on a daily basis about people in systems, this project aims to parallel imagery that we normally see of families with the families depicted in systems. So the intent is to photograph these families as if they are any other families in order to bring general public closer to this subject matter, but also to be able to bring these images to policymakers and psychologists and criminal justice theorists so that such a program can be more widely adopted across the country. This is an incredibly innovative program where children and their parents are able to have an interaction that some of the children say makes them forget that they're in a prison context, which is incredibly powerful. That they're able to have an experience of playing games, of hugging, of sitting on the same side of the table, and of, in the holidays, having the opportunity to make gingerbread houses and to do things that they would be able to do conventionally at home with their parents. So there's a deep sense of connection between the parent and the child, and they're able to simulate that love in the setting, and they're and hopefully the images are able to impart that connection for people who may have a perception that these bonds do not exist and that perhaps the public should not be investing in such programs. It's highly untrue, particularly because these kids often do not get to see their parents throughout the year. Often the Children of Inmates program is the only opportunity they have to interface with their mother or father. So of course this project belongs in the traditional publication context, and it's been featured in Time magazine in May 2016. But the hope is to expand this project over time and make it into a book, which would be the most accessible format for families, for the families of these communities nationally, but also general public families. institutions, schools, but also an easy way to send to legislators and so on. A book is something that can be obviously easily distributed. Another hope is that this project will use these images to form an interactive exhibit that would travel to spaces, and people would be able to interface with the photographs, but also have an audio and motion experience as well. So there would be video, there would be headsets that people could put on. There would also be a virtual reality presentation where people would be able to put glasses on and be in a 360 view of a visit. Virtual reality is now coined by the New York Times as the empathy machine, and the purpose of this project is to inspire empathy, and hopefully that general public will realize the importance of bringing these families together, not only so that these families are able to conserve their bonds or in some situations restore their bonds, but also because it benefits the rest of society. It's obviously shown by theorists that the closer the families are, the higher mental health benefit for the child, but I think also for the parent, as I've realized that the parents involved in the program often have a higher rate of fluid reconnection with families upon being released. So that's a little bit about the project. On a broader scale, I think this project speaks to the ability for family trauma to be repairable. There are a number of people that have come forward who have looked at the photographs who have no connection to the criminal justice system whatsoever, but who have said that it speaks to larger themes of love and loss and healing, alienation, and it evokes much more for people than the social issue at hand, and that is definitely the goal of this kind of image making. So if you have any questions, please feel free to reach out. My email is displayed on the slide. You can also see the rest of the series at www.isadorakosofsky.com, and you can search Children of Inmates on time.com to see the original article. Thank you so much for having me, and I will now hand it over to Jada Hunter.
Hello?
Yes, we can hear you, Jada. Go ahead.
Oh, this is actually Shelley. So thank you all for, I'm Shelley Solomon. I'm the president of Children of Inmates, and thank you all for allowing us. We're very excited to be able to talk to you about what we've been doing in Florida. Basically, our organization started as an experiment. It started back in 2007 before a lot of research had been done on visitation and how it affected children. And so we have used, as we developed the program, we wanted to develop it with research tactics and research information in mind from the beginning, and every small detail that we do is research informed. Our program is a collaboration of 14 organizations working together. We meet every month for about 2 hours, and then in between the months we work together almost every day. But we really work at this using the good to great model, business model to move forward. We do 3 basic things in our program for children. We do care coordination, and what we mean by that is we are reaching out to the families and offering and trying to meet them where they're at. So if we have a child who needs shoes, we're trying to find them shoes. If they need a therapist, we're trying to find them a therapist. If they need a mentor or a buddy, we're trying to connect them to that type of services. If they need a house, we have found people houses. So we are really trying to find out what are the challenges that the children and their caregivers are facing in the community. The second thing that we do is we do what we call child-focused bonding visits. Our bonding visit was actually designed in collaboration or guided by a warden in the Florida Department of Corrections. We approached him and said, we'd like to bring children to visit, and he immediately said, this is what I want to have happen. We then worked with him to find out from a research point of view what would be best to address child trauma, and we've been tracking data on how the visitation program has worked over the past 10 years. And that's one of the reasons that we have so much support and collaboration from the Department of Corrections, is because they've been intimately involved in designing what we do throughout the program. The third thing that we do is we provide advocacy, and when I say advocacy, we do it on two levels. One is that we work with children so that if they're having a problem in school or any place, we will go in and be their advocate, sort of like guardian ad litem. So that's like an individual, same thing with caregivers. We don't do that with incarcerated parents, but we do it with the caregivers and the children. We advocate for them individually. The second piece we do is we do try to raise awareness generally in the public. So we have a large Facebook page with like 8,000 followers and a Twitter where we're trying to publish everything we can get our hands on about this issue. So.
And also, even though we've been around for 10 years, we've been implementing our program for 10 years. In 2014, so I guess that was maybe about 2 or 3 years ago, we did receive funds through state appropriations to expand our work throughout Florida. So we're not only based in Miami-Dade County, but also in counties such as Broward, Palm Beach County, Duval, Panelist, Hillsborough, even Leon County in Tallahassee. So we've been very fortunate, to be able to reach so many families statewide, and that brings us to our next referral, our next slide, to talk about, how many families we have been able to reach.
So the way we reach families is we go in the correctional facility, we put out do a call out where we ask incarcerated parents who would like to learn about our program or to participate to come. They hear about our program and fill out forms which tell us about their children, about their relationships to their children. We have them draw geneograms so we can understand what the makeup is in the family, what information they have or don't have. A lot of them have lost touch with their families, so we become like private investigators trying to find their families. Once we receive the referral, we will try at least 8 times to try to find the family, calling different numbers, going to the neighborhood to see if anybody knows where the family is, and then introduce our services. One of the things that we do with those visits is we make sure that the child is in a safe location. If they're not in a safe location at that initial contact, then we will take action at that point. So we've received about 4,500 referrals, and we currently have about 3,000 children who are participating in the program. In terms of care coordination, some families just want to participate and go on visits, but some families want more services. So we have 2 separate enrollment processes so that we're not forcing people into a program they're not interested in, and they can choose how they want to participate with us. Some folks want to have care coordination and they don't want to visit. Some folks just want to visit and they don't want you in their business. And then some folks want to do both. So and then some don't want to participate at all. So that's how we approach it. It's all driven by the caregiver, and then we also ask the child down to the age of 5 if they're interested in participating. And if they're not, we're not forcing that issue. So we do work with them on that issue. But the vast majority do. Over the past 10 years, we've coordinated now right at 300 child-focused bonding visits. Many of our children have gone with us on every visit for 10 years. So that means that they've seen their parent for at least for 3 hours a visit, every quarter, so 4 visits a year. During the visits, we do try to transform the visiting hall into a child-friendly environment. So we use lots of colors. We learned this actually from Sweden and how they do their visitation. And so we bring in baby masks, we bring in toys. Every child goes home with a toy because we found that that helps them socialize. As you'll see later, over 40% of our children have not seen their parent in 3 or more years, and 3 or more years in a child's life is a very long time. So we are introducing them to their parents a lot of times, and the bonding, having the toys and the way children work in place when they're doing that has been critical to our success in building these relationships.
And also to the bonding visits, that is, I would say, our biggest, one of our bigger achievements, because we are able, as Shelley mentioned, to bring these families together. And even though we do them quarterly, they're theme-based. So we try to, as Shelley mentioned, replicate what they might do, what they might do on a regular outing with mom or with dad, but bring that, inside of the facility. And when they're there for about 4 hours, on the trips. And then afterward, we take them to a special field trip, what we call our after event. And the purpose of that is for them to kind of release some of that anxiety, or maybe, release some of those feelings, because a lot of them, they're upset all over again because now they're leaving. They've had such an awesome and wonderful time creating new memories with their family members and bonding with other children. And one of the things we talked about earlier is that children internalize. They think that it's something that they did, that they said wrong, but then when they get to meet other children that are just like them, and when caregivers get to talk to each other, on these what we call after events, it kind of helps to cement what has just happened, throughout the day. So it's a full day, but it's purposeful and it's meaningful, so that these children and families are looking forward to the next visit. So, and what we like to liken our families to, as far as their feelings and what they're experiencing, is loss and grief. I think we've all experienced loss and grief at some level, but for many of our children, we coin it as a social death. Because sometimes they don't know how to always articulate what they're feeling, or either recognize or identify what they're feeling. So we do have a social work team. So we not only go and provide home visitation, but also we have a social work team that goes along with us on the actual bonding trips to help them and to talk to them and to do even family counseling sometimes, because you have the inmate there, you have the caregiver there, and then you have the child and their siblings there as well. With trauma, we know that always impacts it impacts his developmental path. So losing a parent due to incarceration, that further extends that trauma. So that's what we're trying to prevent.
Just in terms of this, we'll move quickly through this, but as I said, 40% of our children haven't seen their parent in 3 or more years. And we do tools where we measure the success, and about 90% of the participants are self-reporting increased attachment, and we measure that by how often they're talking and writing. We use standardized tools to look at pro-social behavior, and we find that the children are increasing or maintaining their pro-social behaviors in almost all cases because of the visits, we think. We are doing more research on this, and then our care coordination clients are showing more self-sufficiency, also measured by a standardized tool. So the last thing that we've done, and I'll go through this quickly, because we had actually 3 of our infants die within a 6-month period due to accidental death. So we have started a program we call Babies and Brains, where we are teaching about baby safety and baby brain development to get our babies healthy and on track. We're teaching inmate parent workshops. We're doing a home visitation program with every single child who's under the age of 5. We've also created special bonding visits that are just for children under 5 years of age, because this is where you have the greatest effect to start to change these children's lives. So we're excited about this program. It's going well. The incarcerated parents are now talking about parts of the brain, so it's very exciting.
And part of what we're doing, with Babies and Brains is not just working along with the families, but also working with the inmates. So literally teaching them, as Shelley mentioned, parts of the brain, because many of these fathers are in many of our reentry programs. So we're not only helping them to empower them to reenter back into the community, but most importantly, how to reenter back into the home with the children.
This is just an example of one of the geneograms in terms of the complexity of the family. So, for example, this incarcerated dad has 4 mothers associated with his children. And so we are tracking this type of thing to show the complexity of families. They're not standard families in any cases. So it's just one of the things that we're working on as we try to understand how these children are growing up. And so this is our contact information, and thank you for the opportunity.
Thank you, Shelley and Jada, for your really important and critical work and sharing with us everything that you do. My name is Allison Holohan. I am the Senior Policy Manager for the Osborne Association's New York Initiative for Children of Incarcerated Parents. The Osborne Association is a nonprofit. We've been around for 80 years. We work in partnership with individuals and families and communities to create opportunities for those affected by the criminal justice system to develop their strengths and lead lives of responsibility and contribution. We have offices in Brooklyn and the Bronx in New York City, as well as Newburgh, New York, and we have programs in 22 New York State prisons and also on Rikers Island. We also have the Osborne Center for Justice Policy and Practice, which our direct services inform. This is our policy arm, and we're really dedicated to building a justice system that promotes healing, safety, responsibility, and well-being across all generations. So as part of that work, we work to support and advocate for children who have incarcerated parents, and we envision a world in which children whose parents are involved in the criminal justice system are considered, and their needs are safeguarded at every step of the criminal justice process. We launched in 2006, and we're really inspired and moved by the San Francisco Partnership for Children of Incarcerated Parents and the Children of Incarcerated Parents Bill of Rights, which was created by young people. And these rights guide everything that we do. We're really working hard to turn these rights in realities for children in New York and across the country. So much like the work that Shelley and Jada do, we really work to support children's relationships with their incarcerated parents. We run family centers in 5 prisons in New York State, and what those are, they're areas within the visiting room that are very child-friendly. They're filled with games and toys and books, and it's an opportunity for children to spend time with their incarcerated parent in an area where they can just, as Shelley and Jada were saying, they can just forget that they're in a prison, and they can really just spend time doing all of those things that they would do with their parent if their parent was home with them in the community. And so it's really important to have child-friendly areas in prisons when we can have them. But even if prisons don't have those areas, Shelley and Jada said, just the opportunity to be with the parent and be able to touch them and hug them and hold them is really just so important and critical for most children's well-being. We recently went and visited some fathers at Sing Sing, and every time we go visit them, I'm just always so moved by their stories about how they have watched their children grow up in these visiting areas. They are so important. And on this most recent visit, one of the partners that we brought with us, she also had said that she had spent lots of time in that particular family center and that she took her first steps in that visiting center when she was visiting her father years ago when she was a child. So these are memories that stick with children and parents forever, and so it's really important for us to make every opportunity available for children and families to connect. One of the programs that the Osborne Association has is called Family Ties, and we start with working with moms at Albion Correctional, which is about a 10-hour drive from New York City, and we have a parenting class for them that goes for about 10 to 12 weeks, and then when they graduate, we bring their children up to watch them graduate, and it's a really special visit, and we really try and make it fun for the kids. They get to see their moms in a cap and gown, and they can be very proud of them. Their moms get a certificate. There's food, and we have music, and they dance, and it's just such a really important time for these children to be able to spend with their moms. And for many of those kids, they don't ever have the opportunity to visit because it is so far away. And so that's one of the main priorities of the New York Initiative for Children of Incarcerated Parents, is to bring incarcerated parents to prisons that are closer to their children, so children are able to visit on a more consistent and regular basis. Most of our prisons are in facilities that are really, really far away. They're not accessible by public transportation, so it's really hard for families to go and visit regularly or at all in many instances. So much like the work that Shelley and Jada were talking about, it's really important to look at the community, faith-based organizations and other organizations that serve children and families to try and support these families to make those connections. Osborne Association also runs hospitality centers, and those are areas that are adjacent to the prisons that are welcoming centers for families, because many of them drive on buses overnight for many hours, and there's no place for them to go once they get to the prison as they wait for the visiting hours to begin. So this is where they can go, they can freshen up, they can be greeted by a friendly hospitality center staff. We also try and have resources on hand for them, so if there's anything that they're struggling with or they need to be connected with something in the community, we can share that with them. For those who aren't able to visit regularly, we offer video visiting, which is really important supplement to in-person visits. I think that it's really common at local jails to have video visits that are replacing in-person visits, but we feel that in-person visits are so important for families and even more important for children, especially those young children who need to be able to see their parent and be able to touch their parent. And luckily in New York State, we have contact visits, and in New York City at Rikers Island, we also have contact visits for children and their incarcerated parents, which are just really, really critical. Children come to our offices and they visit in a very child-friendly space. This picture at the bottom, you can see one of our young kids, Jeremiah, visiting with his mom. He's playing with, showing her a little cell phone. It's very cute. And he was able to come about once a month to visit his mom. He was very fortunate that his grandparents who were watching him were able to take him to visit his mom also once a month, so that was a really ideal situation for him. But to be able to have these video visits in between those in-person visits were really important for him because he was so young, and those were the years were really formative bonding years. And so when his mom came home, he was able to pretty easily acclimate to her being back into his daily life. He knew who she was. He was calling her mom. They were really able to transition pretty smoothly. Whereas kids who aren't able to see their parents regularly, that's a really hard transition for them. So I encourage all of you to look at ways that you can support visiting, and in-person visiting can definitely be supported by video visiting. States are starting to use video visiting more and more often, so hopefully if your state doesn't have it at the moment, it's something that you'll be able to have available soon. It's really important for youth to inform everything we do. So for those of you who have direct services, we really encourage you to check in with the youth and get their opinions about what they need, what type of programming they felt was effective, what changes that they would like to have. For those of you who might be doing more policy and advocacy work but don't have any direct contact with youth, I really would encourage you to look at some resources that are out there that are youth created. So one really amazing resource is Echoes of Incarceration. They create films about children who have incarcerated parents, and they focus on a variety of issues. They check out their website. There's about 5 videos up there right now. They talk about the importance of visiting. They talk about how important it is to respect and support their caregivers, because a lot of kids may be staying with other relatives or grandparents, aunties, and uncles. And for those who are fortunate to be able to stay with one of their parents, a lot of times that single parent is struggling because they are now not able to rely on co-parent with a mother or father who is incarcerated. And in that spirit, with today's presentation, I spoke with one of our great youth advisors, Moshe, who really gave me some input about what she wanted to make sure that I shared with all of you. She's been in a variety of our programs, including video visiting, and she wanted me to share with all of you that she thinks video visiting is really amazing, and that for youth who start to video visit, that if they're nervous, which is very common, to just let them know that it's going to be okay, and that they should remember to, most importantly, have fun while they're video visiting. So peer support is really critical for children and their caregivers. In that spirit, we have many youth programs here at the Osborne Association that brings children and youth who have incarcerated parents together. And the reason that peer support is really so important is because there's a lot of stigma around incarceration. So in most settings, children may not speak about their incarcerated parent because they fear that they may be judged, and so they keep it to themselves. But when they come to the Osborne Association and they're with other children and youth that have the same experience, they're able to talk about their feelings and what's going on and really make connections. So for the younger children from about 5 to 13, we have recreational activities where the kids come together once a month. Their caregivers bring them as well. So this is a really great opportunity for the youth just to come together, have fun, have a good time, and be around other youth. And, they really make amazing bonds. They'll find out, like, hey, my dad's also at Sing Sing. And connecting the youth is also really important because it brings their caregivers together too. So their caregivers are networking, connecting, and supporting each other without even realizing it. Because you think about how you present support to people. And if you say to somebody, do you want to join a support group? Or you say to a 14-year-old, would you like to join a support group? Probably not. It sounds kind of weird. I'm not sure if I want to do a support group. But if you say, hey, do you want to come on these recreational activities, and then the support just naturally happens, that's what we're really trying to create, that environment so families are come together and can rely on each other. For the older youth, we have 2 groups. We have Youth Experience Success, and that's for our youth 13 to 15 years old. And it's basically an independent living skills curriculum. They come together from September to June, and they learn all kinds of activities. And while they're doing fun stuff and they're learning important workshops such as Know Your Rights, they are also able to talk about their feelings and emotions around having an incarcerated parent. I asked Moshe what were some of the workshops that she really enjoyed the most when she was in YES, and she told me that she really enjoyed the community service piece. They've gone out to soup kitchens and cooked food and served food as well, and they've also gone to animal shelters where they've had the opportunity to feed the animals and take the dogs on a walk, and they've really enjoyed that. So we do that to really foster the idea of giving back to the community and civic and community engagement. She also said that she thought it was really important when she learned about Know Your Rights, so that she would know what her rights were if she was stopped by a police officer. And then another fun thing that she enjoyed is learning about dining etiquette. So we have the youth sit around a table, and we had them set the table and brought food in, and they toasted sparkling grape juice. And so that way when they would go to events in the future, they felt comfortable being at a seated event with fancy tablecloths and everything. And for our older youth, about 15 to 18, we have the Youth Action Council. So many of the youth in our programs are referred by their incarcerated parents who are in our programs in the prisons and jails. Likewise for Youth Action Council, but with Youth Action Council we also do some community outreach. We go to some community block events as well as to some schools to encourage youth to join who are interested in being advocates and building their leadership skills. And like our other programs, all of the youth in these programs have currently an incarcerated parent or have had the experience in the past. And you'll see down here in the right-hand corner there's a picture of the youth on a day that they went up to our state capital, Albany, New York, to speak with elected officials to encourage them to adopt a proximity policy where parents would be moved to prisons closer to where their children live. And it's a very small picture, but I think you'll see towards the middle there is our elected representative, and he is holding a poster of the Children of Incarcerated Parents Bill of Rights, which was really amazing and empowering for the youth. This year, the youth are focusing on proximity again. There is a bill in Albany that they're asking for legislators to support. Last year, when they went up within 2 days, about 5 of the elected officials that they had met with had signed on to the bill. So that's just really empowering and really sends a message to the youth that, yes, your voice does matter, and you do have the ability to come together and make change to have issues that you care about be addressed by our governments. Another great victory for our youth was a few years ago, a bill named after one of our Youth Action Council members, Ashley, was signed into law. And Ashley's bill now requires our New York State Department of Corrections and Community Supervision to post information about visiting, as well as visiting hours and what can and cannot be worn on the internet so that families know, because Ashley was sharing with an elected official that when she would go and visit her parent, that sometimes she would get turned away because she wasn't wearing the right thing, or she wouldn't be able to visit because they didn't show up at the right time because the visiting hours had changed and she wasn't aware. So the youth are a real critical piece in the New York Initiative's work. We work collaboratively with representatives from city and state agencies, community-based organizations, and faith-based organizations to come together across New York State to advocate for policies and practices that support children of incarcerated parents. And our work is really driven by the youth that are in our programs and all of the individuals and families in our programs, because we learn from them what their needs are, and then we work collectively to work towards that change. As I mentioned, stigma is an issue that children and families experience. So a lot of the work that we do in regards to technical assistance to community-based organizations and various systems such as child welfare and education systems really is to raise awareness about the issue, as well as to create safe spaces and the importance. And that is really guided by the Children of Incarcerated Parents Bill of Rights. I have the right not to be judged, blamed, or labeled because of my parents' incarceration. So one of the things I would ask all of you today to take some time and really reflect on what your values and beliefs and opinions are about incarceration. And if you are working with children and families, you need to just be able to kind of know where you're sitting with all of this so that you're able to respond in a safe, non-judgmental way. So often we hear stories about when children do disclose that their teacher may all of a sudden get really nervous and change the subject, or there might be times when somebody will respond, but responds in a way that's not supportive. For example, one young person was saying how she was really looking forward to going forward and having a career in government, and her teacher said, well, it's too bad you're not going to be able to do that because your parent was incarcerated. So it really speaks to the need to raise awareness, as well as to give people the tools so that they can respond in a supportive way when students and children that they're interfacing with disclose, because otherwise children will just keep their feelings inside and not talk about it, and they really do need the support. We encourage people to ask about incarceration, to give. Because of the stigma, families and children may not tell people that they have an incarcerated parent. But if you phrase it in a way that shows to the family that if you disclose that this is an issue for you, then we can support you, then there's more of a likelihood that families will come to you to support. So here is a suggestion that we have. If incarceration affects your family or family you know, we can provide you with supportive resources. Another way to signal that you're a safe person to talk to about parental incarceration is really being mindful of the language that you use. If there's one takeaway that you have for today that you're thinking, what can I do to support children and families affected by parental incarceration? An easy step is to just be mindful of the words that you use. So we ask people to say parent, brother, sister, mother, or incarcerated parent, incarcerated sister, instead of using the terms such as felons, prisoners, ex-cons. I mean, really think about what it feels like for a child to hear the adults around them talk about an inmate or a prisoner when to that child, that's their mom and that's their dad. You'll see a picture here of one of the Echoes of Incarceration film producers who also has gone through all of Osborne's programs. He's got some amazing films on the Echoes of Incarceration website, and he says, he's not a convict, he's an incarcerated individual, and he's also my father. And then another young person states, terms such as felons or convicts may be easier to use, but they are hurtful and stigmatizing to those most affected by a person's incarceration and their family. So for those of you who are offering programs to children and families, just be mindful of not only the words that you use verbally, but also thinking about what's on your print material to make sure that what's there are very positive messages. And that can be a challenge because a lot of us that are working directly with families and a lot of the research out there, we talk about what we're doing to mitigate the risk and what we're doing to make sure that children don't have challenges. But we really encourage all of you to flip that script and think about how is it that we can talk about strength and resilience, because these children are so resilient. They go through so much, and most children of incarcerated parents, especially when they have support, they thrive and they succeed. So I ask all of you to think about your messaging, and if any of you out there are doing research, I encourage you to think about focusing your research on what the resilience is, because we know all about the risks, but we really want to start changing that narrative to talk about what works and how we can support the strengths and the resilience in these children. I also asked Moshe what she wanted me to share with you all around stigma, and she said the most important thing for anybody working with youth is to get to know them and do not make assumptions about them based on the mistakes that their parents have made. So I encourage all of you to follow the New York Initiative for Children of Incarcerated Parents Facebook page, as well as Osborne Association and our Twitter account. In October, we have our annual See Us, Support Us campaign, which is a month-long campaign of activities on social media to raise awareness about children of incarcerated parents and to give those who work with children and families the tools to better support them. And this whole campaign is also infused with the voices of children. It includes a lot of their artwork and stories, and we really hope that all of you can join us this October. So thank you very much, and I'm going to turn it over to Dr. Owed now.
Thanks, Allison. So I'm Makai Owen. I'm a pediatrician at the University of Florida College of Medicine in Jacksonville, and I'm going to talk about how a primary care office, or really any organization that works with children and families exposed to trauma, can identify and respond to adverse childhood experiences. So this topic was included for a couple of reasons as it relates to children of incarcerated parents. First, having an incarcerated parent in and of itself is considered an adverse childhood experience. And then second, which was kind of mentioned earlier, children of incarcerated parents are often exposed to other forms of childhood trauma. And as I'll talk about later, childhood trauma has short and long-term effects on the health and development of children and the adults they become. So it's important that organizations who work with these children have an understanding of the impact of trauma and have an idea of how they can respond to it. So for many primary care offices or any organization working with children, identifying and responding to ACEs can be challenging. Barriers may include lack of time, lack of knowledge, lack of resources, or feeling overwhelmed about the complexity of the problem. In response to this, the American Academy of Pediatrics developed a trauma toolbox, and it outlines the impact of trauma in children and identifies some key steps that primary care providers can take to identify and respond to childhood trauma. As part of this, the Academy makes available a trauma guide that includes a 4-step process that organizations can use to identify and respond to trauma. The guide was developed for pediatricians, but it can be an effective approach for any organization working with children exposed to trauma. The 4-step process is framed with these 4 questions. Why are we looking at this issue? What are we looking for? How do we find it? And what do we do once we found it? So I'm going to go through each of these 4 steps individually. Adverse childhood experiences are considered to be traumatic experiences in childhood that can have negative and long-lasting effects on the health and well-being of children. Experiences range from having an incarcerated parent to physical, emotional, or sexual abuse, and include a host of other traumatic experiences. The animation that I'm about to show is from the CDC Veto Violence website, and it does a good job animating the impact of childhood trauma. So these circles here represent various physical, mental, and behavioral health outcomes, which can be seen on the right side of the screen, things like smoking, drug use, diabetes, suicide attempts. And when we start here at 0 ACEs, all the circles are the same size. As we go from 0 to 1 ACE, the change in the size of the circles represent an increasing prevalence of each of these negative outcomes. And as we move from 1 to 2, 2 to 3, and 3 to 4 ACEs, the prevalence of these outcomes dramatically increases, demonstrating that adverse childhood experiences have a profound impact on health and well-being throughout the life course. These outcomes were originally studied in adults, but we know that traumatic experiences in childhood cause a host of physical, mental, and behavioral health problems in children and adolescents. Childhood trauma can cause significant disruptions in normal brain development. The impact of childhood trauma on brain development is extensive and complex. It's a bit outside the scope of today's webinar, but I think it's important to point out that trauma's influence on the brain can result in problematic behaviors that may make it difficult for a child to thrive at home, school, or other settings. These problematic behaviors, some of which are listed here, may include numbing, hypervigilance, aggressiveness, anxiety, and a number of other challenging or disruptive behaviors. Additionally, trauma disrupts the development of parts of the brain that are responsible for executive functions, like working memory, inhibitory control, and cognitive flexibility. Depending on the child's age and developmental stage, this may manifest itself in a variety of ways, some of which are again listed here. It may manifest as a toddler or preschool-aged child being easily frustrated and having severe temper tantrums, or an adolescent found to be impulsive and aggressive. The ACE pyramid, developed by CDC, represents the conceptual framework for how adverse childhood experiences alter the life course of those exposed to trauma. Adverse childhood experiences can cause disrupted neurodevelopment, which leads to social, emotional, and cognitive impairment, which leads to the adoption of health risk behaviors, which causes disease, disability, social problems, and ultimately early death. And as was mentioned earlier, we know that children of incarcerated parents are more likely to have many of these negative outcomes later in life. This table shows the results of a study published in the journal Pediatrics in 2013. It examined the association between parental incarceration and physical and mental health outcomes in young adults. The red arrows here highlight that parental incarceration was significantly associated with negative outcomes, including heart disease, asthma, migraines and depression, PTSD, anxiety, HIV and AIDS, and fair, or poor health. As demonstrated by these findings, it is important for organizations who work with children of incarcerated parents to understand the relationship between childhood trauma and negative physical, mental, and behavioral health outcomes. Understanding this relationship is the critical first step in developing a response aimed to mitigate the effects of childhood trauma. Once your practice or organization is well-versed on the detrimental impact of adverse childhood experiences, the next step is to determine who should be identified and how. The original ACE study asked questions about emotional, physical, and sexual abuse, as well as household dysfunction, including domestic violence, substance abuse, mental illness, divorce, or having an incarcerated family member that they experienced when they were a child. That is, they asked adults to reflect on their childhood to answer these questions. When considering what to look for when trying to identify childhood trauma, questions for a practice or organization to consider are whether the practice will try to identify ACEs in children, or identify ACEs in their parents, or identify ACEs in both children and their parents. When will the practice assess for ACEs? At the first point of contact, at every visit, or at a specific age? Whether to assess for ACEs using a questionnaire or using direct questioning, and I'll be speaking more about that in a second. And also what types of ACEs the organization will screen for. There's many different forms of childhood trauma, and it may be overwhelming to try to screen for all of them. I don't think there is one right answer for this step. The approach depends largely on your client population, considerations like age of the children you serve, how much of a relationship you're able to build with the clients, and how frequently you provide services to these clients. I think the most important aspect of this step is to try different approaches and see what works best for your organization. The third step in this process is deciding how your organization is going to identify ACEs. As I mentioned a second ago, you may want to use a direct interview approach, or you may want to use a questionnaire. When using direct questioning, as was mentioned earlier, it's important for the family to understand why you're asking the question. In the medical setting, families may not trust us right away, and they often think that we are asking certain questions because we want to remove the child from the home. Before I ask any direct questions related to adverse childhood experiences, I explain to parents our understanding of childhood trauma and explain that I'm asking these type of questions because I want to make sure that my patients have access to any resources that might improve their health and well-being. Another option is to use screening tools or questionnaires to assess for ACEs. The links on the screen, which you can download later, provide a few examples of the many different screening tools that are currently available for organizations interested in screening for ACEs. There are several important factors to consider when deciding which questionnaire works best for your clients. Considerations like when and how the surveys will be distributed, literacy level and transmission needs, how much other paperwork clients have to fill out at each visit. In our clinic, the amount of paperwork can be quite burdensome, so families a lot of times don't finish our surveys. And again, stigma or trust issues that may be associated with families answering the questions honestly. In my clinic, we tried a few of these questionnaires, and we're continually working to identify what works and what doesn't work for our patient population. And we've used some of these and altered the questions to create our own questionnaire that we think is most relevant to our patients. If your organization does use a questionnaire, I think it's helpful to explain why you're asking these questions. Some questionnaires come with a brief explanation of trauma and why it's important for providers to ask these questions. I found the questionnaires to be very helpful in identifying exposure to trauma, and I'd recommend that primary care practices or other organizations working with children and family consider using one of these questionnaires or some type of similar tool. The fourth step in this process is thinking about how your practice or organization can respond once it has identified some kind of ACE or exposure to trauma. And I think this depends largely on the services offered by your organization and its referral network. But I want to talk about a few examples of how you can respond. The first two examples listed here are trauma-informed anticipatory guidance and community resources. And I'll be talking more about those two in a second. I'm not going to say much about therapy, except to say that there are evidence-based therapies for children impacted by trauma. This may include parent-child interaction therapy, trauma-focused cognitive behavioral therapy, and trauma systems therapy. Children can benefit from referral to therapy But if your organization doesn't provide it and is unable to make a referral, having an organizational relationship with the pediatric primary care office can sometimes help facilitate that referral process. So a bit about trauma-informed anticipatory guidance. As a pediatrician, a large part of my job is counseling parents and caregivers on how to respond to challenging behaviors. This is especially important for children who have been exposed to trauma. We know that over time, with calm and consistent parenting, a child's brain and body can learn to respond in a more adaptive way. This chart gives some examples of how a family can respond to symptoms exhibited by a child that has been exposed to trauma. This is again from the American Academy of Pediatrics Trauma Guide, and if you take a look at this guide, you'll see many more examples of how families can respond to certain behaviors or symptoms related to trauma. For example, children exposed to trauma commonly have problems with self-regulation and become easily frustrated or upset. Teaching parents or caregivers techniques such as lowering the tone and intensity of their voice, remaining calm and gentle, and getting on eye level with the child will help the caregiver manage the child's symptoms. If you take a look at the trauma guide, there are dozens more examples. Also, I think this trauma guide is a great resource for anyone who works with children who've been exposed to trauma. Children may exhibit these symptoms in your interaction with them, and having an understanding of how you can respond helps to avoid re-traumatization and will also help manage problematic behavior. I think it's a great resource and definitely worth taking a look at if you're working with children of incarcerated parents. In clinic, we try to give parents and caregivers anticipatory guidance on how to respond to symptoms related to trauma. But more importantly, we try to make sure that families are aware of the available community resources. Fortunately, here in Jacksonville, we have a number of resources available for children of incarcerated parents. We have a working group of community partners that meets regularly to discuss resources available for children and to identify gaps in services and develop a response to those gaps. We have access to the Children of Inmates program we heard about earlier and are able to refer patients to this program for care coordination and or bonding visits. Our community is fortunate enough to have some resources focusing on children of incarcerated parents, but that isn't true for many communities in the United States. Of course, if you're working with children of incarcerated parents, it's important to have an idea of what resources may be available in your community. This website, youth.gov, has a section dedicated specifically to children of incarcerated parents and provides information, tools, guides, and resources to be helpful to individuals or organizations interested in developing a system of care for children of incarcerated parents. Lastly, for me anyway, in our division of Community and Societal Pediatrics, we often talk about the 3 domains of child advocacy. There's a clinical level. For me as a pediatrician, this means the provision of direct patient care. For you, think of it as the primary service you offer as part of your organization. Then there's the community and systems level, which means working to ensure that your community has the appropriate resources in place to meet the needs of children and families. Lastly, there's the policy level, which means advocating for policies that represent the best interests of children and families. Many of us may be used to working mostly at the bottom rung of this pyramid, focusing predominantly on the primary services that we offer through our organization. Fewer of us may be used to working at the community and systems level. By that I mean working to ensure that your community has the services in place needed to address the unique needs of children of incarcerated parents, and not only working to ensure that services are in place, but working to ensure that services are accessible to families and coordinated between organizations to create a system of care. Even fewer of us, myself included, may be comfortable working at the policy level to advocate for policies and procedures that are relevant to children of incarcerated parents. There are many policies at the local, state, and federal level that could have a substantial impact on children of incarcerated parents. Policies like criminal justice reform aimed at reducing the number of people who are incarcerated, or legislation that aims to maintain meaningful contact between children and their incarcerated parents. To meet the needs of children of incarcerated parents and children exposed to trauma, it's important that we work in all 3 domains as much as possible to ensure that not only our individual practices and organizations are meeting the needs of children, but that our larger community and society is committed to making sure all children have an equitable chance to reach their full potential. And with that, I'm going to pass it to Cassandra and Chief Cox, who are going to discuss how law enforcement can safeguard children of incarcerated parents.
Thanks, Doctor. Appreciate that very much, and it's great to be on the phone today. I appreciate the invitation to be here. This is really a great project, and I'm just going to be brief and then turn things over to Cassandra because she has truly brought this to another level, and I think what she has to talk about is extremely important to how we can move this to the next level. To just give everybody a little background, the way that the Albany Police Department got involved in this was a phone call. Jackie Green, who at the time was the Deputy Director of Public Safety for New York State, reached out to me and she asked a simple question, whether or not I was willing to get on a phone call with her and Tanya Krupman from Osborne Association and talk about how we dealt with arrests of individuals around kids being home. So, that seemed easy enough. So we had a good conversation for about a half an hour, 40 minutes. I was feeling pretty good about things, about how we did our job. And then they asked the magic question, whether or not I could share our policies and our training with them so they could help give those to other folks, at which time I realized that I couldn't do that because we didn't have any policy on it, nor did we have any training on it, which is pretty important when we talk about an issue like this. And thankfully, they both said, don't worry about it. You're not alone in this game. So would you be willing to write a policy and help do a training? And we'll obviously be partners on that. And that was an easy answer. So from that moment, we started to write a policy, and we started to figure out training. And then we were lucky because we were on this front end of a great wave where others got involved. So the International Associations of Chiefs of Police got involved. The Bureau of Justice Assistance under Denise O'Donnell, who was a great leader in this project, got involved. And we developed, off of the model policy that IACP and BJA came up with, a policy for the Albany Police Department. And the roll call training that IACP and BJA did, and the IACP training that's online, we were able to roll out to our officers and put the policy out there. And really, this kind of in two stages. So our first stage is really getting out a policy and training around to make sure our officers understood how we respond to calls, how we make arrests, how we plan out warrants when we know there's children around, or when all of a sudden a child appears, or when we have somebody in custody and we're about to lodge them, and we need to make sure that if there's a child at home but that parent is afraid to tell us that we ensure that parent that they're not going to be in any more trouble for this. We need to make sure that there's not a child home that's not safe, that way they have we can get a guardian for them to take care of that child for them. So, we started to really build that. And the one piece that we're now dealing with, and this is why I want to turn it over to Cassandra and let her really talk about the data we've discovered and about trying to build that capacity with our partners, is the second part. Because the first part, and any law enforcement agency that's on the line, I really encourage you to go to the websites. First of all, to go to Osborne, see what they have, because they've got some great material out there. And then go to IACP and DJA and look at the policy, the model policy, and the training. Because it's really a no-brainer to get this policy and training out to your department. Second piece, though, is the harder piece, but it's the piece that's every bit as important as the first piece. It's trying to figure out that follow-through. It's trying to figure out those kids that have been traumatized, how we make sure that they're okay. And that's really outside the scope of law enforcement. We certainly know that we don't want to re-traumatize those kids. I've had the pleasure of having Cassandra be one of my go-to employees and having folks work for the police department that really think these things through and work with our community partners to say, who is available to help us out and what should we be looking for. And that's the second part that's been harder because we want to make sure that we're taking care of those kids, because one of the things we have in the Albany Police Department is called winning over a generation. So we don't want our kids growing up not liking the police. That's not a way to do business. We want to make sure that our kids know that the police are people they can come to for help. We want our kids in our community to grow up and want to be police officers. That's how we change the face of our department. So that second piece is the piece we're really trying to build on. It is definitely the harder piece, but it is the piece that we need to collaborate and work on even harder. So I'm going to turn things over to Cassandra. I really appreciate being on the phone today. I'm happy that even though I'm not with the Albany Police Department anymore, that I've been able to somewhat stay involved in this, and I look forward to continuing that relationship. So, Cassandra, it is all yours, as you have done the bulk of the work with us.
Thank you, Chief Cox. Hi, I'm Cassandra Goddard. I'm the youth aide with the Albany Police Department, and as Chief Cox said, our department goal is winning over a generation. So when we started to put this policy in place, we started looking at some of the data and some of the numbers. And in doing so, we realized that there are a lot of other areas that we have the opportunity to impact. Just to give you a sense of what our numbers look like, in August of 2016, we started collecting data on any interaction that involves a person that's under the age of 18 with the Albany Police Department. So we're collecting demographic information, if the interaction is domestic violence involved, whether the youth was a victim, a suspect, present for an arrest, displaced from their primary residence due to arrest, if they were a missing person or returned person, if the child is placed in one of our residential facilities in our city, or if they were present for some type of other police interaction, such as a raid or something like that. And the numbers were really astounding. And as the chief said, our goal is winning over a generation, and it's intended to improve the quality of the relationship between youth and police in our city. We really sat down and thought about it, and we realized that anytime police are responding to a home where there's a child present is a chance that there's a potentially traumatic interaction occurring, and the police being there, can make that worse. So we wanted to look at the numbers, have the data to sort of back up our ideas so that we could then gear our programming towards creating some opportunities for positive interactions between youth and police. And by doing this, we've also been able to identify, some real gaps in services that are, occurring in our city. In New York State, you don't always necessarily have an arrest that's made when, we're responding to calls. The majority of the calls that children are present for are domestic violence related, and we figured out that those children tend to be from very underserved populations, and we've really struggled to identify partners that could help us with that or existing programs. So what we did is reach out to some local child and youth serving organizations, as well as the SUNY School of Social Welfare and the ACE and Hearts initiative to discuss creating some support groups that are intended really to support these vulnerable populations. We sort of look at any time the police respond to a home, there's a potential for an arrest, and we need to safeguard those children, whether or not arrest is occurring or, potentially could occur at a later time. And so these support groups will be non-stigmatizing. They'll be held in a neutral location like a library, and they will really be intended to be child-focused, but also with an opportunity for parents to, speak to some professionals and to really just connect with other parents who might be experiencing the same type of issues. In 2016, from August through the end of the year, our numbers were up over 1,200 interactions. That's not 1,200 kids, but 1,200 interactions. So you can imagine the amount of children that had multiple interactions with our department. Through the middle of February of this year, we're already up,
to 350 children experiencing that as well. So we really feel that by expanding our processes and implementing some policies such as the Handle with Care program out of West Virginia within our school district, we really have the opportunity to mitigate this trauma and positively impact these children. That is some of the things that we are doing here to support children who are having police interactions and whose parents are potentially being arrested. And at this time, I am going to turn it back over to Selena to wrap things up for us.
Yeah, so we have about 3 minutes left, and so we're going to save our questions for our Children of Incarcerated Parents office hours, which is scheduled for March the 10th, 1 to 2 p.m. Eastern Standard Time. And we have a slide with the number. And again, I'd like to thank our presenters for their wonderful presentations and just for sharing your experiences from such diverse perspectives. And we look forward to the office hours. Here's the slide here with the contact information, the participant code, or you can email me and I can send you that information as well. And we also have several of the resources that our presenters mentioned during their presentations, some of the assessment tools that Dr. Owen mentioned, as well as some of the data to support some of the topics that we discussed today, the videos, the Echoes of Incarceration, the Sesame Street Workshop, the Osborne Children of Incarcerated Parents Toolkit. So there are lots of resources that are available to you. You can download the PowerPoint at the conclusion of our webinar. And finally, we'd like to invite you to participate in our next webinar, our Peer Learning Exchange, which is scheduled for April the 6th, same time, 1 to 2 p.m. Eastern Standard Time. And Dr. Mann from University of North Florida will be addressing trauma and the school-to-prison pipeline. So we're really excited about the webinars that we've highlighted over the past few months, and we look forward to your participation with our upcoming webinars.